Hello, I'm John Reisman, and this is Centrist News and Perspectives, where we focus on evidence, reason, and logic. We need to talk about masks. There's a lot of disinformation going on out there, and it's mostly being spread by some news agencies that are what I consider not as reputable, and also through social media, quite rapidly through social media. Now, the thing about that is that there are a lot of non-experts claiming to be expert, and there's some really funny things that are showing up about this, but those funny things are translating into people getting sick and some of them dying. So we need to understand better what is a good way to manage this situation. First of all, masks are easy to wear. Now, I wear a mask when I go out, and you can see that it's a fairly simple thing to put on. You can walk into a store using your mask. You can walk into a bus or transport system, or if you're hanging around a lot of people, you can wear a mask. It's not difficult. Now, I have a breathing condition, COPD. Am I dying from wearing a mask? No. Are there medical conditions that say I can't wear this mask? There are warnings on some websites that are medically related, but as a certain Dr. Kaufman has pointed out, there's no real reason not to wear a mask unless you have something like second-degree burns on your face. So that's not the big deal. The thing about it is, we have to understand what these are for. And what these are for is making sure that if I cough, I'm not going to spread as much. Now, we've all seen these viral videos, or most have seen them, I guess, where if you spray an aerosol can through a mask, you can see the material coming out the other side. Well, that's high speed. So when I cough, some of the material is going to get out, but less. And remember, this is all about viral loading, and we want to err on the side of caution because you want to make sure your viral load is small. You don't want it to be high because then you're in more danger from COVID-19. So the main thing is wear a mask to help slow down the amount of virus that you might be carrying asymptomatically from spreading to others. Now, if someone else is wearing a mask, let's say I get my mask back on. So what we want to do is if somebody else coughs, and when that person coughs, there might be some material that is, if they have COVID-19, that's coming out of that cough. Because you saw the aerosols can spray thing, you think that masks don't help. But that's high speed and close up. So if I cough right at the mask, yes, some will escape. But now it's low speed. Now it's in the air. So now the mask is protecting me from someone else's cough. So when you wear a mask, you're protecting others in case you're asymptomatic and carrying the virus. And of course, you're protecting yourself from others that might be carrying it asymptomatically and not know it. So it's really just really smart to wear masks. The R0 number in most countries was driven down by people social distancing, wearing masks, and basically keeping separation so the virus can't spread. As soon as we started mixing again, we saw the numbers beginning to rise again. So it's very simple. Wash your hands, wear a mask, social distance. That's it. And these spreads will slow down and eventually come down to a sane level. Again, wear a mask, social distance, wash your hands, very simple, and let's stop the spread. I'm John Reisman, and this is Centrist News and Perspectives.